Hello friends, this is the second part of the diuretics, that is the clinical applications of the diuretics. So in this part we will see the clinical applications of various kind of diuretics. So very first is carbonic anhydrase inhibitors. So these are the various uses of the carbonic anhydrase inhibitor. Very first is a glaucoma. Now there is an increased aqueous humor synthesis, and to reduce the this will create an unwanted intraocular pressure. So to reduce the aqueous humor synthesis, the carbonic anhydrase inhibitors is used. It is simply in the chronic as well as the acute and second primary and secondary glaucoma. The carbonic anhydrase inhibitor are used. So they reduces the aqueous humor synthesis and thereby they reduces the intraocular pressure. Now, they are also used as an adjuvant therapy in the treatment of edema due to the congestive heart failure. We have already seen in the heart disorders that due to serious heart disorder, there is a edema, and this edema can be very effectively reduced by the carbonic anhydrase inhibitor. There is one special type of a use of the carbonic anhydrase inhibitor that they are used in epilepsy, like a petit mal epilepsy, grand mal, myoclonal jerk, and the exact mechanism how this carbonic anhydrase inhibitor work as an anti-epileptic agent is not clear over here. As we will see the anti-epileptic agent in some other place, that at that time the how this will be used as an anti-epileptic agent and what is the mechanism of action that we will see in that time. Now, the another use of the carbonic anhydrase inhibitor is that they are used in acute mountain sickness, where the symptoms include nausea, vomiting, dizziness, insomnia, pulmonary edema. So that can be reduced due to the carbonic anhydrase inhibitor. Whenever the person is going to the high altitude, at that time these symptoms we can face, and these symptoms can be reduced by using the uh, carbonic anhydrase inhibitor. Carbonic anhydrase inhibitor, we have already seen the mechanism of action. They alkalinizes the urine. So whenever there is a carbonic anhydrase inhibitors are used, they are always used in combination with sodium bicarbonate, so that a significant amount of uh, carbonates can be made available to excrete in the urine, as well as the body pH can also can be maintained, because it lead to the formation of the systemic acidosis. So uh, which can prevent the development of uric acid nephropathy. This is one of the thing which is available with the carbonic anhydrase inhibitors. Next is osmotic diuretics, well-known diuretics which is used mainly whenever there is a problem to itself to the kidney, whenever there is a glomerular filtration is there, and they are only filtered through glomerulus and does not interfere anywhere to the electrolytes or any kind of a receptor. They are used mainly for the oligouric phase of acute renal failure. Whenever there is a renal failure, at that time mainly the osmotic diuretics are used. So they maintain the urine flow without affecting the glomerular filtration. Osmotic diuretics create an osmotic pressure, and by that way they produces the diuresis. So without affecting the glomerular filtration rate, that too much glomerular filtration, and that is affecting the, like that way it does not happen over here. So without affecting the glomerular filtration, it creates the osmosis, because they drain the water from the tubules. They maintain the urine volume and prevent the anuria. There is a reduction in the rise in intracranial pressure. This is one of the main aspect of the osmotic diuretics. They reduces the intracranial pressure. Prevention of preoperative renal function in the patient undergoing the major vascular and cardiovascular surgery, those in the jaundice, where the osmotic diuretics are preferred. They promote the diuresis and minimize the risk of acute renal failure in the patient after the renal transplantation. After renal transplantation, mainly the rejection potency might be there, and to overcome this, the osmotic diuretics are mainly given. So mainly the bowel preparation before the colorectal surgery or coloscopy or barium enema, the osmotic diuretics can be given to reduce the volume inside the urinary system. They also promote the urinary excretions of the toxic materials. Toxic material excretion can be accelerated by the osmotic diuretics. Next, the clinical application of a loops diuretic. Now we know with that loops diuretic, they are one of the most potent diuretic, and they reduces the extracellular volume very significantly. So they are used in a treatment of hypertension. But one of the limitation is that it is not a first line agent. It is always given as a second line agent, and uh, they are used in a limited kidney disorders. They are due to its high potency, their applications are little bit limited. They produces a quick and large reduction into extracellular fluid volume. So loops diuretic are working extraneously. They are working very potently, therefore quickly, and very large amount of fluid is excreted. So effective in reducing the edema and cardiac dysfunctioning, like a cardiac congestive heart failure. Whenever in the congestive heart failure a very large amount of edema is produced, so due to its potency and quick action, they can be effectively used. So they are also widely used in the treatment of pulmonary and systemic edema. Pulmonary and systemic edema can be significantly reduced by the loops diuretics. They are also used in hepatic cirrhosis and nephrotic syndromes. They also reduce the serum calcium level, hence lowers the calcium level in hyperkalemic and hyperparathyroidism conditions. They are counteracted. They used to counteract the hyperkalemia potassium level. The hyper level, they can be to reduce that. The loops diuretics are used, and they also facilitated the rapid removal of the toxic substances from the kidney. Next drug is a thiazide diuretics. It is one of the primary or main drug which is used for the primary hypertension, along in or alone or along in combination with the other drugs. So it is a first line agent. Thiazide is a first line agent which is used in the management of a kidney, and it is one of the FDA approved drug for the management of hypertension. So they are generally given along single or in the combination with the other drugs. So adjuvant therapy, that can be it can be used as an adjuvant therapy in management of edema in a chronic heart failure, edema associated with the chronic heart failure which is leading to the edema, and in that condition it is used as an adjuvant therapy. So it is one of the mild kind of agent. Thiazide agents are mild kind of agents. Okay, so they are used in edema caused by the various forms of renal dysfunction such as nephrotic syndrome, ocular glomerulonephritis, or chronic renal failure, and in that conditions also thiazides are used. They are indicated for the nephrothaliosis, osteosporosis, and diabetes insipidus. These are the conditions where thiazides are used. They decreases the urinary excretion of calcium and used to treat the calcium nephritis and osteosporosis. These are the clinical applications of thiazides. Now next and the last most is the potassium sparing diuretics. The clinical applications that they causes the hyperkalemia. They excessively loses the potassium ions. So in the patient with chronic renal insufficiency or hyperaldosteronism, they should be used with the cautions. So these drugs are weak diuretics and produces mild diuresis. But the hyperkalemia conditions, it is one of the typical applications of the potassium sparing diuretics, because they excrete the potassium very highly. Most effective in primary and secondary hyperaldosteronism. Potassium sparing is highly recommended in these conditions, and in combination with thiazides and loop diuretic, they are also used for the treatment of edema. They are also very effective in treatment of mild to moderate hypertension. So mainly the hyperaldosteronism, hypertension, these are the primary uses of the potassium sparing diuretics, or along with the thiazide they are used in the treatment of edema. So these are nothing but the some clinical applications of the potassium sparing diuretics. So here we finish the topic diuretics. If you have any kind of a problem, you may contact with the given numbers, and you can write to me by at the given email ID. Thank you very much.